Massage and acupressure to prevent and treat diabetes. Hi. Acupressure therapy is a drug-free method that is very effective and has been scientifically proven by many studies. Using acupressure therapy can very well control the rate of blood fat, while control medical conditions related to the kidneys, nerves, retina, etc., and especially very well control the rate of sugar in the blood, thus actively contribute to preventing and reversing diabetes. If you also have blood sugar problems that are not type 1 diabetes, you can absolutely refer to the exercise I introduce below. In this exercise, we will apply a classic set of 3 important acupoints: Sanyingyo, Diji, and Zhangmen. To follow and practice this exercise, we should sit on a sturdy chair. Later you can practice massage and acupressure on yourself anywhere and in any position you find convenient. Now, first of all, we will act on the Sanyingyo acupoint. The Sanyingyo acupoint is the 6th point of the spleen meridian. You can take a closer look at the location as well as how to accurately find Sanyingyo acupoint in SP6 video. The Sanyingyo acupoint is very famous in the past to be applied in classic acupressure dealing with diseases related to gynecology, andrology, etc. However, Sanyingyo acupoint also have directly related effects to the functions of the spleen, then related to the pancreas with the secretion and action of insulin, directly affect blood sugar conditions. And in this exercise, we will first act on the acupoint Sanyingyo, activate and coordinate to increase treatment efficiency for other acupoints. To obtain the Sanyingyo acupoint for massage and acupressure as content of this exercise, you just need a few simple steps to locate it. Specifically, please follow me. We are seated on a chair like that. We are going to look for the acupoint on each leg. Here I find the Sanyingyo acupoint on my right leg. Please observe carefully and practice with me. We will identify 2 important milestones to determine the location of the Sanyingyo acupoint. This is the tibia, and this is the posterior margin of the tibia. The Sanyingyo acupoint is located near the posterior edge of this tibia. This is the inner top of the ankle, the most prominent part of the bone. I repeat, this is the top of the inside of the ankle rather than the top edge of the peg like this. We use 4 fingers closing together like this. Put your hand on your ankle. The outer edge of the little finger coincides with the top of the medial ankle. The outer edge of the index finger meets the posterior edge of the tibia. This point of intersection is the location of the Sanyingyo acupoint. To stimulate Sanyingyo acupoint, there are many simple ways you can refer to. For example, here I present you a technique so-called press release technique. Namely, I put my tibia horizontally on the chair like this, then you can use the tip of your thumb or the middle joint, or even joints like this, then perform a press release directly in the acupoint. The pressure is relatively strong, enough to cause pain within your tolerance. With the help of the other hand, we can stimulate Sanyingyo acupoint like this in a great way. Can do it during the break. Relax. The time needed to act on this acupoint continuously is about 3 to 5 minutes. Then we use the heel of the hand like that to press directly on the acupoint for a moment before moving on to stimulate the Sanyingyo acupoint of the other leg. Same technique and duration of action. Plus, once you've mastered it, you can also act on the Sanyingyo acupoint while lying down, for example when you are in bed. You can use the heel of one foot to directly press the Sanyingio acupoint of the other foot, also with pressure intensity in pain tolerance and with a continuous time of 3 to 5 minutes is suitable. After stimulating all two Sanyingio acupoints of both legs, we're going to move on to the second acupoint of today's exercise. This is the DG acupoint. You can take a closer look at the location and how to accurately determine DG acupoint in SP8 video. Just like the Sanyingio acupoint, the DG acupoint is also located on the spleen meridian, and since time immemorial the DG acupoint has always been counted first in formulating a specific therapy for a patient for the prevention and treatment of diabetes. And, in Oriental medicine, the DG acupoint has been considered a signal point for diabetes, because it has a special feature. If a diabetic person is pressed on this acupuncture point, it will be very painful. We can even say that it is extremely painful, unbearable. In order to accurately determine the DG acupoint, let's first place the shins relatively perpendicular to the thighs like this. Next, you need to identify a few key steps. First, the posterior edge of the tibia should be identified, as the DG acupoint is located near the tibia. Second, must determine the concave point just below the tibial plateau like this. And then, just use the hand with 4 closed fingers like that. The width of these 4 fingers is equivalent to 3 cun. I put my thumb on the popliteal fossa. Place the index finger in the depression near the lower edge of the tibial plateau, that is, the outer edge of the index finger is near the lower edge of the lower surface of the tibial plateau. And so, the outer edge of the little finger, its intersection with the posterior edge of the tibia, is the location of the DG acupoint. To stimulate the DG acupoint, we can also have several ways. It depends on individual health status and preferences. Here I would suggest using the tip of your thumb, one hand, or preferably both thumb tips like this. You will tire less and stay interested longer. The technique used here is also press release with sufficient pain intensity within your tolerance. Such continuous acupressure time also lasts about 3 to 5 minutes. Later, you should also use the heel of the hand to press the acupoint like this for a while before moving on to work on the DG acupoint on the other leg, same technique and duration of action. After stimulating Sanyingio and DG points on both legs, we are going to work on the last acupoint, which is the Zhongmen acupoint. You can review the location and how to accurately determine Zhongmen acupoint in video LV13. The Zhongmen acupoint is the 13th point located on the liver meridian. Also from time immemorial, the Zhongmen acupoint is associated with the name the acupoints for the treatment of diabetes. In reality, the Zhongmen acupoint is often applied by Oriental medicine doctors for diseases related to weak spleen, congested qi and blood, melancholy, loss of appetite, indigestion, enlarged liver and spleen, etc. At the same time, the Zhongmen acupoint is considered one of the 3 important acupoints in a set of 3 legendary acupoints for the treatment of diabetes are Sanyingio, DG, and Zhongmen. To stimulate Zhongmen acupoint, we also have many ways. But here I would like to introduce you a very easy way to stimulate, easy to implement, but very effective. So, one should sit on a recliner and lean back as much as possible, so that the ribs protrude as high as possible. Then, just like in the LV13 video content, I was very careful show how to determine the Zhongmen acupoint. The Zhongmen acupoint is located near the beginning of the 11th rib. It's the end of the free coast, that is, it is not connected to the sternum like 10 pairs of ribs above. In reality, the end of this 11th rib is at the level of the point of the elbow if the hand is in such a position. However, for the treatment to be most effective, we should stimulate the acupoint as precisely as possible. Specifically, from this position of the end of the elbow, try to feel and find the tip of the 11th rib. There is my elbow, and the head of the 11th rib is somewhere in this area. Here, I feel the ribs from above to find the difference. Here, if above I see a continuum. Then down here, I can clearly see the end of a rib. Since it's the first, it's definitely the 11th rib head I need. Located near the front of this end is the position of the Zhongmen acupoint. And, instead of acting aimlessly and superficially massage the entire abdomen at the point of the elbow, we will try to do the right thing to the correct position of the Zhongmen acupoint, that is to say, stimulate only the beginning of this 11th rib. Come on, let's sit leaning back to raise the ribs as high as possible. We will use two hand heels like this, press in a circle directly on the two areas of the Zhongmen acupoints on both sides. That is to say that we will press simultaneously on the ends of the two 11th ribs of these two sides. The two heels of the hands press in a circle, counterclockwise and anticlockwise according to each hand. The pressure on the acupoint is also relatively strong, not too much pain, but also exerts a positive stimulating pressure on the acupoint. Note that it is possible for someone to make a mistake doing this. That is, they believe that it is necessary to massage the internal organs. Specifically here, being within but holding closest to the outside, on the right the liver, on the left the stomach. The purpose is to stimulate Zhongmen acupoint but not to directly massage the liver and stomach, not as effective in treating diabetes as the purpose of this exercise. In reality, you can press massage the Zhongmen acupoints on both sides like this continuously for 3 to 5 minutes. But if you massage that gently, it can last longer, maybe even 10 minutes. You can also massage the Zhongmen acupoint while you are in bed. And, it is best before sleeping and right after waking up. So, with a set of 3 important acupoints mentioned above, Sanyinjiao, Diji and Zhongmen, you should practice massage and pressure daily and regularly. Think of it as a lifetime exercise for you. An active and healthy life cannot be complete without exercise, and if you have blood sugar problems, so add this massage and acupressure on the same list as your daily workout items. I wish you a good practice. Practice diligently. Prevent and ward off diabetes effectively. Thank you, goodbye, and see you soon.